So I'm going to talk about conjunctival limbal autograft. Here are my financial disclosures, none relate to this talk. So a quick review, we know what the devastation that occurs when we lose limbal stem cells. We have epithelial defects, corneal scarring and ulceration. We have a secondary conjunctivalization of the cornea, severe visual loss and secondary pain. And then if there is significant amount of limbal stem cell loss, we have zero chance of a successful keratoplasty. We talk a lot about the limbus, but we forget to talk about the conjunctiva. And there are conjunctival stem cells, multiple foci through the conjunctiva, concentrated in the fornices. We have epithelial stem cells and goblet stem cells, and these are as important, if not more important, than limbal stem cells, because what happens when we lose our conjunctiva? We ultimately get limbal stem cell deficiency. We get a severe dry eye. We get simple front formation, and then the worst case is surface keratinization. And these are the most challenging patients we take care of. So today I'm going to talk about the use of conjunctival limbal autograft for unilateral stem cell deficiency. Obviously, our procedure of choice, if we have a unilateral disease and the fellow eye is normal, and if there's any question about the fellow eye, it's really not worth taking these cells from that eye. It eliminates the complications of rejection, obviously, which is our biggest challenge in allografts. But this procedure provides limbal stem cells as well as conjunctival stem cells, and that's why it's our procedure of choice. Interestingly enough, it was first reported by Barricare in 1964 at the World Cornea Congress, in which he talked about an autograft procedure, and you can see his schematic is pretty much what we do now, except we take a lot more conjunctiva. The procedure was basically forgot about until Kenyon and Sang reported it in 1987. This is my first case I did back in 1989, a patient with an alkali injury and a persistent epithelial defect, and we took, you can see this is the conjunctival limbal autograft inferiorly in this eye with his inflamed cons that we didn't operate on, but a stable epithelial surface, and the patient did extremely well. So this procedure has been somewhat challenged because people are concerned about what happens to the donor eye, and we'll get into that. And it's been so successful that a lot of us haven't even looked at our results, but we finally decided to take a look and see how well we did. So we did a retrospective evaluation on patients who had unilateral total limbal deficiency, not partial, in which we used a conjunctival limbal autograft, 27 eyes, and the follow-up, which I think is critical to looking at success rate, an average was 4 years and up to 15 years, and you can see the breakdown of the preoperative diagnoses. We had a stable ocular surface at 78%. We had partial failure in 22%, which meant there was more than 50% of the epithelium that was normal, but we had no total surface failure. So every patient improved, and the vast majority improved completely. Preoperative vision was 2400. The mean post-op vision was 2070. About half the patients got better visual acuity than 2040, and about half the patients had to go on and get a penetrating or DALK procedure. We did have some infections, but all these patients are at risk to secondary infection. We saw about 15% microbial keratitis, but we didn't see a problem with the donor eye, but we continue to get question is, what is the risk to the donor eye? So we finally went back and reported our series of donor eyes, which was reported in the journal Cornea last year. We looked at all cases of conjunctival limbal autograft donors. 26 were pure CLAUs, 18 were combined with the keratolimmal allograft, and then one case was combined with a living-related conjunctival limbal allograft. Again, the follow-up is critical. Range was 8 months to 15 years, but an average of about many years. And we saw no difference in the donor eye and the fellow eye, or the pre-op and post-op visual acuity of the donor eye. All of the donor eyes maintained stable ocular surface and clear corneas. We saw no late staining in the peripheral cornea of the donor eye, no neovascularization, no conjunctivalization. So basically, all the donor eyes appeared healthy in this study. So what are the alternatives to conjunctival limbal autograft? Well, the CLET procedure has had a lot of interest. This takes 2 to 3 millimeters of so smaller amount of limbus, and it's cultured and expanded. Issues with this, number one, is certainly very expensive. Two, you get a very limited number of stem cells. We get no conjunctival cells, so you really can't manage those patients with conjunctival disease, and we don't have great long-term studies. The other procedure, the so-called SLET procedure, again, a small amount of limbus is taken, and this is then cut into small pieces and placed on the cornea. Again, we get a very limited number of stem cells. We get no conjunctival stem cells, can't manage conjunctival disease, and we don't really have good long-term data, although there are some suggestions as you look out past 2 and 3 years, this procedure does not maintain a healthy surface. The literature has multiple reports on CLET, SLET, and a few reports actually on the oldest procedure, the CLAU. And the problem with the literature on this is that a lot of the eyes in the CLET and SLET publications had partial limbal deficiency, and we only reported total limbal deficiency. But if we look at our outcomes, again, our last 32 eyes of all total limbal deficiency, short-term success 90% versus CLET 69% versus SLET 77%. And remember, these had partial limbal deficiency cases mixed in. Long-term success, that's defined as total successful ocular surface 80%. We had no patients that went on to total failure, and we don't have long-term success yet for CLET or SLET, meaning beyond 3 years. So in summary, I believe for unilateral disease in which the fellow eye is normal, the conjunctival limbal autograft is your procedure of choice. It has the best long-term safety and efficacy data. It provides us with conjunctival tissue to manage conjunctival disease as well as limbal disease. We transplant the whole limbal niche, which in a lot of researchers consider that very important instead of just isolated stem cells. And we have shown that there is no real risk to the donors in following these patients for many years. Thank you.